Outbreak Management Section, IPC Standards, Response Framework and Role of an IPC Specialist. My name is Binu. I work as an Assistant Director of Midwifery in Rotunda Hospital, Dublin. Outbreak management ensures early detection, control and prevention of infection in healthcare setting, guided by IPC specialists through IPC standards and a structured response framework. IPC specialists play a key role in managing the outbreak, leading the surveillance, coordinating response efforts, and implementing IPC measures to protect patients, staff, and the healthcare environment. Maternal and neonatal patients are particularly very vulnerable to infections due to their weaker or developing immune systems and close contacts in the healthcare settings. This makes them at high risk of rapid deterioration if exposed during an outbreak. Because of this vulnerability, a rapid and coordinated IPC response is very critical. Early detection, immediate isolation whenever needed, and strict adherence to hand hygiene and timely implementation of control measures are needed. Prompt action by the IPC specialist not only protects mothers and newborns, but also prevents wider spread within the healthcare environment, ensuring safe care to the patients and staff. This is Rotunda Hospital, where I work. It's actually one of the oldest maternity hospitals in the world, providing continuous care to women and babies since 1745 and operating its current location since 1757. This long history highlights its strong tradition to safe and high-quality maternity care. In such a specialized setting, outbreak management is very essential to protect vulnerable mothers and newborns from infection risk. It is only guided through the IPC standards and structured response framework to ensure rapid and effective action during a suspected outbreak. IPC specialist plays a very important role in this process. We lead the surveillance, coordinate the outbreak response, support the clinical teams, ensure that evidence-based IPC measures are implemented during an outbreak. Rotunda Hospital looks after patients from diverse population, including patients from migrant communities, shared accommodation, and from lower socio-economic backgrounds, which can increase outbreak risk and complexity. Public health may notify the hospital of some of the outbreaks, such as chickenpox in the community or in the shared accommodation, allowing early awareness and coordinated response. Close collaboration with the public health supports surveillance, contact tracing, and outbreak control. This is actually a good view, and you can probably see the challenge, IPC challenge, from the infrastructure itself. So Rotunda Hospital is a 198-bed teaching institution providing specialist maternity and newborn care, supporting women and their families at local, regional, and national levels. This hospital infrastructure presents an ongoing infection prevention and control challenges, which are regularly risk assessed to identify and manage potential areas of concerns. To address these challenges, we work as a multidisciplinary team with a strong focus on communication, surveillance, and adherence to IPC standards. This collaborative approach is essential in preventing outbreaks and managing a safer environment for patients and staff. An outbreak is defined as two or more linked cases of the same infection or a colonization caused by a same organism. It can be also identified when a number of new cases exceeded what is normally expected in a given setting. Surveillance plays a very critical role, especially because some infections or colonization may be asymptomatic and not immediately obvious. Importantly, even in a single case of a rare or unusual infection should raise concern and may be considered as a potential outbreak. Early recognition is the key prompt control measure and preventing the further spread. Let's quickly see the types of outbreak. So there are 3 different types. Endemic, which can be constantly present. Disease is constantly present in a specific area. For example, malaria. Hyperendemic means disease occurs at constantly high levels. Epidemic means a sudden increase of a case above what is normally expected. Pandemic, we all probably are aware of this stage about pandemic. They are endemic that can spread across countries or continents, affecting many people. The main goals to identify outbreaks is to reduce illness and prevent any complications. So how do we identify outbreaks? Outbreaks are identified through surveillance. Surveillance is a continuous collection and analysis of the health data. There are different types of surveillance: passive surveillance and active surveillance. In passive surveillance, which relies on routine reporting and it can be delayed, but active surveillance involves proactive data collection and making it more timely and accurate. There are two types of aggregate data, which can provide general information like age or location, and case-based data includes detailed clinical information such as symptoms and presentations. So in Ireland, we have health protection survey and surveillance center, where we notify all the diseases, infectious diseases, especially the diseases like tuberculosis, measles, malaria, COVID-19, etc. So this center keeps all the records and give us a surveillance report weekly. Let's see about the roles and governance structure during an outbreak. If an outbreak is suspected in a hospital, for example, in our hospital, once the outbreak is suspected, infection control team informs the executive management team. Usually it is the director of midwifery chairs the outbreak meeting and sends out meeting invitations, minutes, and reports to all outbreak committee teams. If the outbreak is suspected or confirmed, an outbreak team is formed and outbreak committee decides from there. Outbreak management follows a very clear step-by-step of process to ensure rapid control and prevention of infection spread. Detection is usually carried out by the microbiologist, IPC specialist, or the clinical staff who identifies unusual pattern or confirmed cases in the clinical area. A risk assessment is then completed jointly by the clinical staff and the IPC specialist to evaluate the severity and potential spread of infection. Control measures are implemented immediately, such as isolating the symptomatic patients and the close contacts to ensuring staff use appropriate PPE to prevent further transmission. During the investigation phase, IPC and the clinical team review the patient movements, location overlaps, and shared equipment use, decontamination practices, and environmental cleaning frequencies. Effective communication is very essential throughout this process, ensuring all multidisciplinary teams are informed promptly. For example, if there is a need for enhanced cleaning, housekeeping staff has to be informed. Finally, an evaluation is carried out through daily monitoring by IPC specialists to assess the effectiveness of control measures and ensure the outbreak is fully contained. This is the Outbreak Control Committee members. So the effective outbreak management relies on a multidisciplinary teamwork committee members. So senior management is included in the committee. Then we have the IPC nurse or a specialist leads infection control activities on the ground, supporting the implementation and the control measures. Consultant microbiologist, antimicrobial pharmacist, infectious disease team guide the diagnostic interpretation and treatment decisions. Depending upon the type of outbreak, pharmacy and the lab will be involved as well. Multidisciplinary staffs like housekeeping, occupational health, technical service, etc. will be included in the outbreak committee. Next is the roles and governance. So as I said, the outbreak is led by the clinical director. In our hospital, it is done by the director of midwifery, IPC team and midwifery and neonatal leads, and hospital executive oversight. Again, outbreak committee, extra people's, I have discussed about this. Public health is informed as well about the outbreak. Environmental health officer is included. Catering department and additional expertise are involved as well. Key roles are ensuring adequate resources is available. For example, making sure nursing and maternity care assistant ratio is maintained through ADOM on-call to support the department during an outbreak is very important. Daily communication to the clinical staff on the floor is very crucial at the clinical rounds. IPC presence in the clinical environment is very important for staff support and answer all queries related to outbreak. So the main aims of outbreak management is quickly to identify and control the spread of the infection to protect patients, staff, and the visitors. It focuses on preventing further transmission, especially among high-risk groups like in our hospital it is the neonates and the postpartum mothers. Another key aim is to reduce any harm by ensuring early intervention, effective treatment, and appropriate infection control measures. Outbreak management is also aims to identify the source and contributing factors so that the targeted actions can be taken. Finally, it supports long-term prevention by improving policies, strengthening the staff education, and enhancing the surveillance system. Identification of the sources. So, likely the outbreak sources can be based on the pathogen or a mode of transmission. So the outbreak source identification is guided by the pathogen or a mode of transmission. For example, if it is Legionella, it is related to water systems. Patients' journeys are reviewed to identify any common locations, procedures, or exposures, including shared environment products or any equipments. Key areas including surgical procedures, line insertions, dialysis, adherence to the care bundles, etc. The environment, healthcare workers, and contaminated products are reviewed as well. In case definition, we use clinical criteria which describes the typical signs and symptoms of the disease, provide general outline for identifying a suspected case, or a lab criteria is used as well involving diagnostic test. So assessing the patient. Outbreak investigation begins with identifying any signs and symptoms or onset to develop a clear case definition, which may include clinical or lab criteria. We will look at any signs and symptoms and relationship of the cases, and then potential causes, and then case finding is done. Case finding helps us to establish the outbreak onset, possible cause. It identifies the size and the extent of the outbreak, identifies patients needing the care. It guides us where the control measures are needed, monitors their effectiveness, and helps determine when the outbreak can be declared as over. Sources of case finding. It can be, again, I discussed all this already, clinical, lab, and screening test, or reviewing the historical lab results, or GP, household, or occupational health. We all know this chain of infection. This is if once we break this chain of infection, that's where we end up with outbreaks. So that's very important. So I just included that slide in the... Let's talk about immediate control measures. What can be put in place? The appropriate control measures can be varied depending upon the agent and the mode of transmission. The key step is to isolate and cohort symptomatic patients. If there is no isolation rooms available, there will be probably a need to cohort the patients together in one room. It will help to prevent further spread of infection while also allowing time to consider and rule out alternative diagnosis. It is also very important to control the source of the pathogen whenever possible. Again, additional control measures can be put in place. For example, treat the confirmed cases promptly and appropriately to reduce the severity and transmission of diseases. Restrict the spread by closing an affected room or ward to admissions and transfers, depending upon the outbreak size, severity, and transmissibility. Confirming the diagnosis. That is very important as well. Ensuring appropriate specimens are tested in the lab using correct swab and sampling technique. Communication, that plays very important role in the management of an outbreak. Senior management must be informed due to the potential impact on the service delivery, including ward or bed closures or possible disruption of elective procedures and outpatient services must, such as cancer care. Bed management team needs to be communicated properly about the bed shortages, housekeeping, general services, everyone in the multidisciplinary team in the outbreak committee needs to be communicated properly about the outbreak. Again, occupational health has to be informed as well if there is a staff involvement in the outbreak. Again, visitors, visiting restrictions. So IPC need to actually meet with the executive management team to take decision about visiting restrictions, requirement of PPE use by the visitors and staff, and strict hand hygiene education for the visitors and staff to reduce the transmission risk has to be discussed with occupational health as well. If any of the staff is unwell, the staff has to be allocated to link in with occupational health for further management. All the communication has to be done through internal leadership briefing. Public health authority has to be notified. Transparent patient and family communication is very important as well, especially for the babies in an ICU. Parents needs to be informed. Daily institutional situational updates has to be done at everyday rounds. As an IPC specialist, we have to make sure there is appropriate PPE available, making sure that staff, whether staff available and the correct use of PPE. If staff training is needed, we have to provide the training. Enhanced cleaning protocols has to be put in place. Medications such as antivirals or prophylaxis should be accessible where indicated. And if there is a need for vaccine, staff needs to be linked in with occupational health for same. IPC needs to check regular outbreak committee meetings should be held to coordinate the response and ensure actions are being implemented effectively. Daily review of the cases is essential to monitor the trends, identifying the new cases early and assess whether the transmission is ongoing. Control measures should be continuously evaluated, looking to see whether the cases are stopping or returning to the baseline or continuing, whether we need extra interventions. In some outbreaks involved, a reference lab may be necessary to isolate and type the isolates and determining with the microbiologist whether the cases are linked or helping them to clarify whether the transmission routes are identified. Once the outbreak is over, this has to be clearly communicated to all relevant staff and the stakeholders. A formal outbreak report should be written outlining key contributing factors, what interventions has worked well and lessons learned for future prevention and response. Any recommendations identified should be implemented to strengthen the system and reduce the risk of reoccurrence, and including updating the policies, staff training and infection control practices. Now let's see about the role of IPC. IPC specialist plays a very key leadership role in identifying outbreaks early by spotting unusual patterns or clusters. Once it is identified, they confirm whether an outbreak is occurring or ensuring it is reported to appropriate public health authorities in a timely manner. IPC carry out detailed risk assessment along with the clinical staff, investigations to understand the situation fully, identifying the infections, how it is spreading, whether it is spread through contact, droplet or airborne transmission, and which groups are most at risk. They work closely with the clinical management team, microbiologist, lab and hospital management to gather and interpret relevant data. Based on this information, IPC specialist implements and enforces appropriate IPC control measures. Again, IPC plays a very critical role in making sure there is importance of strict hand hygiene, correct use of PPE among the staff. They ensure environmental cleaning and disinfection practices are intensified to reduce the contamination and prevent further spread. Again, ward closures or visiting restrictions, if it has to be in place, it has to be guided through IPC. IPC specialist also provides education and guidance to the staff during an outbreak. Clear communication is very crucial because it ensures all staff understand updated protocols, including correct use of PPE, hand hygiene, and transmission-based practices. Again, this is the screenshot of the role again. So IPC promotes patient and staff safety, investigate and manage infection outbreaks, conducts audits and ensure compliance with the PPE, educating the staff on hand hygiene and safety practices, develop and implement infection control policies, monitor and prevent healthcare associated infections. IPC leads the outbreak review and analysis, updates the policies, identifies the gaps. For example, in hand hygiene, if we need to actually give more attention to the parents or patients' hand hygiene, it is the role of the IPC to make sure that they link in with the IPC link staff to provide it. Let's see why outbreak management matters. Certain groups are at very high risk during an outbreak, including neonates and postnatal mothers in our hospital, especially in other medical hospital can be the elderly population or immunocompromised patients. Close contacts between individuals can be significantly increased risk for transmission, especially in a healthcare setting. Once it is identified, infection can spread very rapidly, and that is why we need to intervene in between to prevent the transmission so that we can control it in a safer way. These are the core IPC standards in a hospital settings. As we all know, we all are familiar with hand hygiene, WHO 5-moment standard and transmission-based precautions, staff competency and ongoing training, environmental cleaning and sterilization, PPE compliance and auditing. So this, we have, as an IPC specialist, we have to make sure it is actually in place. I just wanted to show you an example of a quality improvement initiative after an outbreak. We have introduced a new technology where we can actually scan using barcoding. We can actually scan the equipments after the decontamination. We can actually scan the staff ID and we can actually scan the cleaning episode and we can actually scan the patient equipment, what is actually decontaminated. Even at the daily cleaning of the equipments, we can actually do that. So this is actually, we have introduced a new technology in our hospital. I just wanted to finish off with just saying a story about an outbreak. It's actually only a story. So there was a patient who admitted at 38 weeks in our hospital in labor, delivered and transferred to a postnatal ward in a shared accommodation. The patient reported having 3 episodes of loose stools in the postnatal ward. Midwife, while risk assessing, realized the patient had 3 loose stools antenatally as well and had a very sick child with same at home. So the patient was isolated in an ensuite room with contact precautions. Second case was identified in a postnatal ward in the same room with the same signs and symptoms and as isolated, and decision to call it as an outbreak management committee meeting, which was escalated to the executive management team. All close contacts were isolated in the same room and 2 more patients developed same symptoms and isolated. Enhanced household cleaning measures were put in place. All patients were involved, were informed using open disclosure protocol and watched for signs and symptoms. All staff communications were done through the clinical managers. Action plans were discussed and distributed among the OCT team. OCT team met weekly until it was closed after 72 hours of the last patient's symptom. I just wanted to say acknowledgements to my colleagues. I would like to say sincere thank you to everyone who has contributed to the completion of this work. Especially I wanted to thank Dr. Deirdre, consultant microbiologist, Dr. Megan, consultant microbiologist, and my colleagues Alva, Shona, Sinu, and Fumi. They are here with me with full support. Thank you. And I just wanted to say a few words in the thank you. As we are celebrating our Hand Hygiene Day next month, the theme is Action Saves Lives. So if we are actually concentrating on reflecting on the approach of hand hygiene, we can actually save lives and avoid outbreaks. Thank you.